Several women in Arizona were recently sent to emergency rooms after getting cheap lip injections during a house party.
Yeah, it's an alarming trend that points to the importance of having cosmetic procedures done by a licensed professional. Here to talk about it is Dr. Sabrina Fabi. Tell us a little bit more about what happened. And this is one of those stories that you hear about all the time. People, really just going to someone's house and having these events.
I know. So we feel like we cover it like every year there's something, right? And so I think we're seeing this because there's a rise in these minimally invasive cosmetic procedures being done. 16.8 million reported just last year by the American Society of Plastic Surgery. The American Society of Dermatologic Surgery reported 9 million of them being done by dermatologists. So you can imagine how many procedures are being done. The number one procedure still remains Botox or the neuromodulators. And we see and hear about these neuromodulator parties or Botox parties, and they're not really being injected with what they think is an FDA-approved substance. But fillers are the second most common product that's injected or that are minimally invasive. And these are dermal fillers. They're intended to improve fine lines and wrinkles, but they also tend to be a little bit more expensive or pricey. 1 cc, which is a fifth of a teaspoon, roughly can be anywhere between $600 to $800. And so you can see that as the rise increases in how many people are doing these, people may want to venture and try something. And in this particular party, this operator, because they weren't even a physician or practitioner, was injecting this material for $60 per cc and stating that it was something that was approved when in fact they still don't even know what the substance was.
So that's why people do this. It's the cost, it's the simplicity. Your friends are doing it sometimes in a case like this, right? But you wouldn't go to a friend's house and get brain surgery.
Right.
It's a medical procedure.
Or your
right?
chemo, right?
Yeah,
and you don't go with the cheapest chemo.
Yeah.
And I always tell my patients, it's not like you go for the breaks that are on sale
right.
or, that are like the cheapest that you can possibly get. This is your face. You only have one face. And so even though it seems like it's an aesthetic procedure like getting your hair done, even that some women won't let anyone touch. This is your face. You only have one of it. Ultimately, you're dealing with a very complex anatomy with a lot of blood vessels that are connected to your eye. Now certain reports have been out there with blindness. So people have to be aware of the person that's administering these treatments to make sure that they are board certified aesthetic doctors, either a dermatologist, plastic surgeon.
That's a legal thing too. I mean, here in California and I believe in Nevada, they have laws that you have to be a doctor or at least supervised by one, right?
Right. So in Nevada in 2017, they changed the legislature so much so that even I as a physician used to go and teach there, couldn't inject product to teach in a hotel at a conference, because now it not only has to be done under the supervision of a doctor, but it has to be done in a medical facility or medical spa. That's how stringent they become because of these butt injections where people were being injected with cement, and we covered that story about 4 years ago. Just last year we covered the story in Nevada, in Santa Fe, New Mexico, where people were giving HIV by using microneedling devices and these vampire facials in facilities that were not accredited to be able to, handle bloodborne pathogens. So these are still medical procedures.
So what can people do to protect themselves? Because we see a doctor's office, a legitimate doctor's office having a grand opening and it's a party, and so people get excited about it.
Right.
And then you have a friend who says, we're going to do something at Joe's house, it's more intimate, so you'll get a better deal. So what can people do to differentiate and protect themselves?
So if it's too good to be true, it most likely is. You should treat this like you would treat a surgery, right? You wouldn't just go to a friend's house and have it done. So you want to look at the reviews of your doctor. You want to look at before and after photos. You want to actually confirm that the person has been there for a couple of years and it's an established facility. You see places sometimes, I have patients come in and they tell me that they went to their doctor and there were signs up that they're gone and no one was ever told, So you don't want one of these fly-by-night clinics. You don't want to go to one of those places. And obviously if you know of anyone who's injecting any of this illegally, then you should absolutely contact that medical board of that particular state to notify them.
Okay, good information. Do your research.
Yes.
Follow the law.
Too good to be true.
Yeah.
It always is.
Yes. Dr. Fabi, thank you so much as always.
Thank you so much for having me.